So here we are going to talk about the Interpartum diagnostic test. So what are the important tests we have to do during the pregnancy? So we can find out who is under high risks. Monitoring is important. So Antipartum diagnostic test usually schedule for antepartum healthcare visit. So during 28 to 32 weeks of pregnancy, mother have to go to visit every 4 weeks for first 28 to 32 weeks. Then every 2 weeks for 32 to 36 weeks. And finally, every week when 36 to 40 weeks of pregnancy. So every 4 weeks, then every 2 weeks, and finally every week. So in this time, we will check chorionic villus sampling, amniocentesis, alpha fetoprotein, or sonography, biophysical profile. Who will check it? Who is under high risks? Who is under high risks? Who have a positive family history or some complication. The first one called blood type and RS factor, research scanning or research scanning. ABO typing is performed to determine the mother's blood type in ABO antigen system. And research typing, or shortly called RS typing, is done to determine the mother's blood type in research antigen system. So RS positive indicate the presence of antigen. RS negative indicate absence of antigen. If the client RS negative and has a negative antibody scan, the client will need to repeat the antibody scanning. So research scanning or RS factors testing, if the alloimmunization is a concern, if mom is RS negative and baby is RS positive, in that scenario, it is important. If there is any blood mixing, and mom can develop anti-RS antibodies. So mom immune system can then attack the RS antigen positive fetus and causes the fetal anemia. So a common question sometimes NCLEX board asks, if mother is negative and baby is positive, what we will do? So they said mother should receive the RHOD immunoglobulin at 28 weeks gestation. So if mom is RS antibody negative, if baby can be RS antigen positive, then use the RHOGAM ROGAM at 28 weeks. That's it. So what next? Next antepartum diagnostic test, urine analysis and urine culture. So a urine specimen we collect to check for glucose level and protein level. Usually a healthy mother or healthy person, urine supposed to glucose free, protein free. If urine contains the glucose, it indicates diabetic. If urine contains the protein, it indicates mother under risk to develop eclampsia or preeclampsia. So urine analysis, basically we are going to diabetic scanning. So here glycosuria is a common result of decrease the renal threshold that occur during pregnancy. If glycosuria persists, this may indicate diabetic mellitus. So when you diagnose a mother have a diabetic, so with diagnosis of diabetic, usually more than 20 weeks of gestation. Two scenario. Sometimes mother has a history of diabetic. Then mother should be control the blood sugar level. But if mother never diabetic before, but after the pregnancy, mother start the blood glucose level is high, we call gestational diabetic. So we have to control it as well. So the risk factor basically for diabetic, if mother body mass index more than 30 or history of pre-diabetic or family history of diabetic, right? So it is important for our NCLEX board. Also, we check the urine for white blood cell. If in urine white blood cell is present, it indicates the infection. We must need to culture what antibiotic mother need and treat them first. Then ketonuria may result from insufficient food intake or vomiting. Ketonuria. Protein level, if 2 plus to 4 plus in urine, it may indicate infection or it may indicate preeclampsia. Usually, healthy person urine will be protein free. When protein is there, means kidney is not working well. So what next? Next is the ultrasound or ultrasonography. So ultrasound diagnostic procedure during high frequency sound wave to visualize the developing fetus. So you see the mother is here, then a device is putting over the abdomen, and in the videography, we can see the fetus. So in this procedure, high frequency sound wave used to visualize the developing fetus, right? Let me read it. Outline and identify fetal and maternal structure. What are the indication? So by sonograph, we determine the fetus and placental position, the structure, gestational age, and amniotic fluid volume. right? It is here. And may be done abdominally or transvaginal. So in this picture, you can see the ultrasound transducer we use over the abdomen, like this picture. But another way we call transvaginal procedure through the birth canal during the pregnancy. So again, if I ask you, what are the indication of ultrasound? It is the confirm, it can make or confirm that pregnancy, site of implantation, also assessment the fetal growth, development, and movement, and can be used to determine the presence of premature dilatation of the cervix, we called incompetent cervix. A transvaginal ultrasound is used during the first trimester to check the length of cervix. So what are the intervals, or what are the procedure we have to do? So always before this test, tell your patient have drink 1 glass of water prior to the procedure to better reflect sound wave. So in this picture, you can see this is the uterus, amniotic fluid, and baby. So the advantage of ultrasound, it is safer, okay? It is safe. And also here, if an abdominal ultrasound is being performed, the mother may be asked to drink 1 glass of water to fill the bladder before processed to obtain a better image. If a transvaginal ultrasound is being performed, a lubricate probe is inserted through the birth canal. Inform the client that the test present no known risks. So this is the advantage of ultrasound, right? And especially when mother come in the first trimester, we confirm intrauterine pregnancy or any ectopic pregnancy. We can confirm gestational age or single or multiple pregnancy. When mother come in the third trimester, we can assessment the fetal well-being, position, orientation, right? What next? So next test is biophysical profile. So biophysical profile is a non-invasive assessment of the fetus that include the fetal breath movement, fetal tone, amniotic fluid index, and fetal heart rate pattern. So basically, this test combined with non-trace test with ultrasound measurement. There are 5 criteria we use for the scoring. So we use the Apgar score for fetus and biophysical profile we use for infant. As I told you, there are 5 criteria, what they are. And every criteria have a score or point. If it is normal, 2 points. If abnormal, 0 point, 2 point for each. So comprehensive assessment of 5 criteria of biophysical profile. One is fetal breath movement, or we call the breathing movement. So when it is normal, patient get 2. If no episode in 30 minutes, 0. Fetal movement of body and limb. So gross body movement, like 2 hands and 2 legs movement, 2 torso and limb movement, baby get 2 points. Muscle tone, fetal muscle tone. So one bend or strengthening of limb and tongue means the movement. Amniotic fluid volume, right? Another criteria. Reactive fetal heart rate with activities. And that is we called non-trace test. So biophysical profile, the combination of non-trace test with ultrasound measurement, right? It is wrote here. Let me read it. Combined NST means non-trace test with sonogram, ultrasound estimated the fetal breathing, movement, and muscle tone or flexion movement. It is a scoring system. So the score of usually 8 to 10 is normal. If score is less than 8, indicate fetal has a asphyxia. Asphyxia means less oxygen supply to the body. And so it is done over 30 minutes. It measure or identify acute hypoxia or chronic hypoxia. So another Antipartum diagnostic tests are percutaneous umbilical blood sampling. So perform it, the fetal blood sample is necessary. Involve insertion of a needle directly into the fetal umbilical vessel under ultrasound guided. And fetal heart rate monitor if necessary for 1 hour after the procedure, and follow up the ultrasound to check for bleeding or hematoma formation is done 1 hour after the procedure. So in this picture, you can see a needle is passing to collect the blood sample under ultrasound guided. So in this picture, this needle directly pushed to the umbilical cord. And here you can see blood is collected from umbilical cord. This is the sampling. So percutaneous umbilical cord blood sampling we need. And blood is collected from umbilical vein. This is the umbilical vein. You can see in this picture here, umbilical vein. So to detect the fetal infection, fetal anemia, RH sensitivities, or any chromosomal defect. So when you collect the tissue, then you scan it and you find out any fetal abnormalities like infection, anemia, RH sensitivities, and chromosomal defect. Usually, this test is performed after 18 to 20 weeks or before 34 weeks. So if the patient has a anemia after this test, better to perform transsacral droplet to confirm. Okay. So what next? Chorionic villus sampling. So this test is performed at 10 to 20 weeks of gestation to detect any kind of genetic disorder. So if parents have a positive family history of genetic disease, they usually request for this test. So chorionic villus sampling, the portion of placenta is aspirated through the catheter or syringe to assess for chromosomal abnormalities. Usually this is performed 10 to 30 weeks of gestation. So what are the intervention? So before to go the intervention, I want to tell you what are the advantages, what are the benefit of this test. So provide early diagnosis of abnormalities, right? So, and also this test can perform as early as 10 weeks. It is earlier than amniocentesis. So early we can detect, allow for any early termination. Like if parents have a defect baby, they want to terminate the pregnancy after genetic counseling, they can do this. So by this test, we can detect genetic abnormalities or obtain the karyotypes and also gene consequence. But this test have some complication, like patient chance to develop chorioamnionitis or premature rupture of the membrane or miscarriage. The client may need to drink water to fill the bladder before the procedure. This is the intervention, right? To tell your patient to drink 1 glass of water, so it will be visible, it will be easy to collect the tissue. Obtain the baseline vital sign, fetal heart rate, monitor frequently after the procedure. Rh negative mother may be given Rho immunoglobulin because chorionic villus sample increase the risk of Rh sensitization. The nurse need to ensure that the informed consent has been obtained for any procedure that is invasive, and chorionic blood sampling is an invasive procedure. Let me recap what are the complications. Patient chance to develop chorioamnionitis, premature rupture of the membrane, or miscarriage. So before the procedure, it is our responsibilities to explain mother about this, the complication of chorionic villus sampling. So Antipartum diagnostic test, alpha phetoprotein scanning. So by this test, we can find out some genetic disorder, like assess the quantify of fetal serum protein. Abnormal protein level are associated with open neural tube defect or abdominal wall defect. So this is the alpha fetoprotein is a protein. By check this protein, we can find out the neural tube defect or Down syndrome. Alpha fetoprotein we can perform at 14 to 16 weeks of gestation. So you can see this is the picture. It is the neural tube defect or spina bifida. When alpha fetoprotein is below normal, down, decrease, patient develop Down syndrome. When alpha fetoprotein is increased, patient develop neural tube defect. So it is important for NCLEX board. What next? In here you can see the different type of neural tube defect. The first one you see is called anencephaly. So open brain and lack of skull. And this one is called anencephalocele, herniation of the meninges. And this one spina bifida, and this is called meningocele, and this is myelomeningocele. Spina bifida, here neural tube defect does not fuse well. Anencephaly, the brain, absence the skull, and anencephalocele. So usually spina bifida, after the surgical management, patient can survive, but anencephaly or encephalocele, the baby will not get chance to celebrate their first birthday. So they did not survive. So what are the intervention? So alpha fetoprotein level determined by maternal blood sample, we draw it or perform between 16 to 18 weeks. And if the level is abnormal and gestation is less than 18 weeks, second sample we can draw. If ultrasound is performed for elevated level, roll out of fetal abnormalities and multiple gestation. So what we have to know from here, let me recap it. When alpha fetoprotein reduce, patient develop Down syndrome. When alpha fetoprotein is more than normal, patient develop neural tube defect. The next one is called DNA genetic testing. So can be used to detect any abnormality related to inherited condition. So we called genetic scanning or testing. So we can scan for genetically transmitted disorder, genetic defect. So assist to determine if the woman is at the risk for having a defective fetus like Down syndrome, Edwards syndrome, Petau syndrome. Down syndrome, basically chromosome 21 defect. Edward syndrome, chromosome 18 defect. Petout syndrome, chromosome 13 defect. Easy way to remember: puberty, 13 years old, Petout syndrome. People can vote when they're 18 years old. So chromosome number 18, Edward syndrome, election age. And drinking age, so you are allowed to go to the bar and drink when you are 21, right? So chromosome 21 defect is called Down syndrome, right? Intervention, this type of testing can be done as early as 7 weeks of gestation, and a blood sample are used. So next test is amniocentesis. So what is amniocentesis? When it is done, an interpretation of result, patient care, and complication. Important to know. So amniocentesis can perform after 14 weeks to rule out any congenital abnormalities. So aspiration of amniotic fluid and best perform in between 15 to 20 weeks of pregnancy, because amniotic fluid volume is adequate and many viable fetal cells are present in the fluid by this time. So in this picture, you can see the uterus, and this is the baby or fetus, and surrounded by the fluid we call amniotic fluid. This is the needle or syringe passing under the ultrasound guided, and we collect the sample. So performed to determine genetic disorder, metabolic defect, or fetal lung maturities. So by this process, amniotic fluid is aspirated under ultrasound guided. So many books are said this test performed after 14 weeks. So there's some risk factor related to this test, like chance of maternal hemorrhage, infection, RS isoimmunization, abruptio placentae, amniotic fluid emboli, and premature rupture of the membrane. Because in this procedure, the sampling of a small amount of amniotic fluid through the transabdominal needle aspiration. So this test we use to diagnose some genetic disease like neural tube defect or other genetic disorder included Down syndrome. So what are the complication, right? Or risk factor again. So in this picture, we can see the fetus. The green one is amniotic fluid, and amniotic fluid draw with a needle under ultrasound guided. So what are the intervention? So if less than 20 weeks gestation, the women should have a full bladder to support the fetus. If more than 20 weeks of pregnancy, the women should have an empty bladder to minimize the chance of puncture. prepare the client for ultrasonography, which is performed to locate the placenta and avoid placenta of it, obtain the baseline vital sign and fetal heart rate. And we monitor every 15 minutes. Position the client supine during the procedure and on the left side after the procedure. So during the procedure, supine, but after the procedure, encouraging mother to left side, right? So after chorionic villus sampling and amniocentesis, instruct the client that if patient have a fever, chill, bleeding, leakage of fluid at the needle site, or if the fetal movement decrease, uterine contraction or cramping, they must inform the healthcare provider. So one of the major complications of this test, the chance of fetal loss or chorioamnionitis, fetal injuries, all of these are complications of amniocentesis. In this space, we can go a short review, the purpose, the reaction complication, procedure, and result. So the purpose, diagnostic genetic disorder and neural tube defect. So when we draw alpha fat fluid and check the alpha fetoprotein, when alpha fetoprotein is higher level, associated with neural tube defect or spina bifida. When alpha fetoprotein low level, it is associated with chromosomal disorder like Down syndrome. And some books said by this test, diagnostic test, we can check the lecithin and surfactant ratio. And it would be 2:1. And 2:1 ratio indicate the fetal lung is mature for respiration. Risks and complication, chance of miscarriage, amniotic fluid leakage, infection, or injury to the baby. So if the mother under the risks of or complication, why we do this? Because if the parents have a positive genetic defect in the family, then parents wants to do this for a disease-free baby, right? So patient care is so important. So during this procedure and after the procedure, patient education and care is important. So have the patient empty bladder prior to the procedure. And after the procedure, admin RH-GAM or ROGAM to RH negative mom. Also encouraging the rest and plenty of fluid after 24 hours. So they said procedure consists of withdrawing a small sample of amniotic fluid from uterus with a long, thin needle, right? It is an outpatient procedure taking 45 to 60 minutes. So result can take from 3 days up to 4 weeks. So what else? The next test here is called kick count. So fetal movement count. So the client is instructed to sit quietly and or lie down on bed on her side and count the fetal kick for a period of time as instructed. Instruct the client to notify healthcare provider if there are any fewer than 10 kicks in 2 consequence 2-hour period, right? Or is instructed by healthcare provider. Another test is important, we call fun test. So this fun test look like the plant's fun. I left a picture there. But when you collect the sample and it is seen under the microscope, it look like this pattern. A fun-like pattern that result from a salt of amniotic fluid indicate the presence of amniotic fluid there. So let me go back. The fun test, a microscopic slide test to determine the presence of amniotic fluid leakage. With use of a sterile technique, a specimen is obtained from external os of the cervix and vaginal pole and examined on a side under a microscope. What are the interpretation? A fun-like pattern that result from the salt and amniotic fluid indicate presence of amniotic fluid. So what is the intervention? Position the client in a dorsal lithotomy position. Instruct the client to cough, and this causes the fluid to leak from uterus if the membrane are ruptured. So if the membrane rupture and fluid came out, we collect the fluid and check it. And we can see this is the fun-like pattern. So we can see fun test positive indicate the presence of amniotic fluid, means membrane rupture or leakage. Another test is called nitrogen test. A nitrogen test strip is used to detect the presence of amniotic fluid in vaginal secretion. So vaginal secretion have a pH is 4.5 to 5.5. So vaginal secretion is acidic and do not affect the color of nitrogen strip because it is acidic. But if the amniotic fluid in the secretion with the vaginal secretion, it will be changed the defined color in the nitrogen strip. So again, I said amniotic fluid supposed to be inside the uterus in amniotic sac, right? So if any leakage there, fluid is coming with the vaginal secretion, then pH will be changed because amniotic fluid and vaginal secretion pH is not same. You can see this is the strip. So again, let me recap it. The vaginal pH is 3.5 to 4.5 or 4.5 to 5.5 means it is in acidic. So they, in case leakage there, amniotic fluid is there, that turn blue in presence of alkaline amniotic fluid. But naturally, if you put the nitrogen strip, the color will not change because vaginal secretion is acidic. But when amniotic fluid mixed with it, the strip turned to blue it means alkaline secretion is there. And we know amniotic fluid is an alkaline secretion. False positive sometimes for urine, blood, or trichomoniasis infection. So nitrogen test, amniotic fluid have a pH is 7 to 7.5 and turn the nitrogen strip or swab blue. Intervention, position of the client in a dorsal lithotomy posture. Also touch the test tab in the fluid. Check the test trap for blue-green, blue-gray, or deep blue color, which indicate that membrane are probably ruptured and causing the leakage of amniotic fluid. It is more than enough about the nitrogen test. Next to test here, non-trace test and contraction trace test. Very important for NCLEX board exam. So here we are going, what are the non-trace test, what are the indication and interpretation of the result. Same as in contraction trace test, we will discuss about what it is, indication and interpretation of result and complication. So non-trace test here, it is non-invasive test that is measure the fetal heart rate in response to fetal movement. And the non-trace test performed during the third trimester. So let me read it. Evaluate the fetal heart rate pattern in absence of regular contraction to determine fetal oxygenation or neurological and cardiac function. So by this test, what we will check it, what are the indication? So decrease the fetal movement or diabetic or gestational hypertension or post-maturity. This is the indication of non-trace test. So a non-trace test is a common prenatal test used to check for baby's heart rate. During a non-trace test, the baby's heart rate is monitored to see how it responds to the baby's movement. The terminology non-trace refers to the fact that nothing is done to place the trace on baby during this test. So you see the mother is here and a vibrator device may be used to awaken the sleeping fetus. So mom push the button attached to the monitor when she feel the fetal movement. So what are the interpretation of result? So they say 3 negative in a row to interpret result of non-trace test. So non-reactive means it is the normal. It is the normal findings. Fetal heart rate has a normal rate, no moderate variabilities, and accelerate more than 2 times in 20-minute time period. So non-reactive, non-trace, okay? This is the interpretation. But I said reactive, it is the normal findings, but non-reactive is the abnormal findings. So let me recap it. So here, non-trace test, when we see it is reactive, indicate it is a normal. So fetal heart rate accelerate means 10 to 15 heartbeat per minute in 10 minutes in response to baby's movement. But when we see the non-trace test is non-reactive, this is abnormal. It means fetal heart rate does not accelerate sufficiently with the fetal movement. So further assessment needed. So in this picture, you can see the mother sitting down, a monitor is attached with mother uterus and devices there. So mother can push the button attached to the monitor when she feels the fetal movement. So let me read it. The non-trace test is performed to assess the placental function and oxygenation. The test is determined fetal well-being. Test evaluate the fetal heart rate in response to fetal movement. What are the intervention? An external ultrasound transducer, or we call dynamometer, are applied to the client, and also tracing of at least 20 minutes during duration is obtained so that fetal heart rate and uterus activity can be observed. The baseline blood pressure is obtained. Blood pressure is monitored frequently. The client is placed in a lateral position to avoid the vena cava compression. The client may be asked to press a button every time she feels the fetal movement. The monitor records a mark at each point of fetal movement, which is used as a reference point to assess the fetal response. So in non-trace test, so well-oxygenated healthy fetus should have spontaneous or temporary increase in fetal heart rate, and we called acceleration. And non-trace test is a 20-minute measurement of fetal heart rate using the ultrasound. We call cardiotocography to check the acceleration. That's it. So what are the results? Let me read it. Reactive non-trace test, it means normal findings. Reactive indicate a healthy fetus, very important for NCLEX board. It make confusion during the exam time. And non-reactive means abnormal findings. So reactive means the result require 2 or more fetal heart rate accelerate of at least 15 beats per minute, lasting at least 15 seconds for beginning of the acceleration to the end, and is associated with the fetal movement during the 20-minute period. 15 roles. What else? Non-reactive, non-stress test, what is called abnormal. So no acceleration or acceleration of less than 15 beat per minute or lasting less than 15 seconds in duration. So at least for NCLEX board exam, you have to know the non-stress test reactive means normal findings and non-reactive means abnormal findings. What next? Next one is a contraction stress test. What it is? What are the indication and interpretation of result and complication? This we are going to talk. So contraction test, also called oxytocin challenge test. So more invasive test we used to measure the fetal heart rate in response to contraction. So a measure to identify the fetus that is at the risk for intrauterine asphyxia or usually shown if there is a placental insufficiency. So we can do this when anything like this. So contraction stress test, a method to observing the response of a fetal heart rate to the stress of uterus contraction. So when uterus is contraction, what are the change occur in fetal's heart rate response? So how we can start this contraction? By oxytocin or nipple stimulation. Oxytocin is used to induce the contraction. So a fetal heart rate response to 3 spontaneous or induced uterine contraction in 10 minutes may occur. So it will be spontaneous, or as I told you, we use nipple stimulation or we use oxytocin or pitone. And desired result would be negative. So negative means normal, don't miss it. So negative means no late deceleration. So what are the indication of contraction stress test? So non-reactive test, stress test, or high-risk pregnancies, right? Here showing the interpretation of contraction test. So we assessment of how fetus will handle contraction of childbirth and induce the contraction with oxytocin or nipple stimulation to achieve 3 contraction in 10 minutes. So this said negative means 3 contraction in 10 minutes. This is normal with no sign of late deceleration. Positive means repetitive persistent late deceleration occurring with more than half of the contraction. So again, I said positive means abnormal findings, and it means late deceleration present in 50% or more of contraction and indicate of problem. What problem? Uteroplacental insufficiency, right? So sometime NCLEX board asks, What are the complications of contraction stress test? So the complication contraction lead to premature labor. Okay. So let me read it. Contraction test. The test assesses the placental oxygenation and function. The test determines the fetal ability to tolerate the labor and determine the fetal well-being. Fetus is exposed to the stress of contraction to assess the adequacy of placental perfusion under simulated labor condition. The test is performed if non-stress test is abnormal. So non-stress test or NST if abnormal means non-reactive. Then we can go for contraction test. Intervention here. External fetal monitor is applied to the client. And 20 to 30 minute baseline strip is recorded. Uterus is simulated to contract by admin of a dilute dose of oxytocin or by having the client use nipple stimulation until 3 palpable contraction will have with a duration of 40 seconds or more in a 10-minute period have been achieved. Frequent maternal blood pressure records are done and also monitor to mother is monitored closely while increasing the dose of oxytocin are given. So this is in the picture showing external fetal monitor. This is the monitor attached with the fetus, and this is the ultrasound guided contraction, which we call transducer. It is showing the contraction and uterus and fetal heart rate. So negative contraction stress test, it indicate normal findings. Don't miss it. During the exam, you do mistake here. And also what means a negative result is represented by no late deceleration of the fetal heart rate. So fetal heart rate with 3 contraction in 10 minutes. Positive contraction test, what is called abnormal, means a positive result is represented by late deceleration of the fetus with 50% or more contraction in absence of hyperstimulation of the uterus. So this is the basic about the Interpartum diagnostic test, what is really important for NCLEX board exam.